Good morning, everybody. Thanks for joining us. If you're joining us right now or about to join us, we're about to go live and talk about Medicare, which is a topic of great interest to probably everyone in this country, from people like me, the provider, to people like you, the patient. And I'm doing this as part of my ongoing quest to educate people, to empower them to take better care of themselves. Part of that is making good financial decisions, and one of those major financial decisions in life is which Medicare, which letter, what type of Medicare, et cetera, et cetera. I find it complicated and difficult to understand, so I know a lot of other people do too. So we're just going to try to break it down and make it easy for everybody. This will be available on my website later if you don't digest it all right now, or you know somebody in your family that isn't on live with us that wants to watch it. And we'll do it again periodically, because I think it's super, super important to make a really good decision when it comes to picking the right Medicare as you go forward, because I can see it from the provider perspective. Some people are limited in what they can get, and some people aren't. Great health care, some people don't, and it all comes down to which Medicare they picked, or which type of Medicare, I should say. So thanks for joining us, all my Facebook people out there. Healing Soul, Well Theory, and Warner Orthopedics. We really appreciate it, and hopefully this will impart some knowledge and help you, which is really all we want to do. I think we're going to start shortly here once I get the signal. Is it? We ready to start? Okay. All right, so we're going to start now. So good morning. We're live, and we're doing a webinar about Medicare. So some tips and some information on what is Medicare, what is A, B, C, D, E, F, G, all the different letters, and what do you pick, and why would you pick one way over the other way? So I'm Dr. Meredith Warner from Warner Orthopedics and Wellness, and I have a practice in Baton Rouge where we focus on empowering people to get the best out of life. So musculoskeletal health, which is obviously what orthopedics does, is a big part of that. But to have good musculoskeletal health, you have to be well, and you have to have deep health inside. And so we focus on every aspect of health in order to get them moving and be functional and optimal in life. We offer a lot of services here for that purpose. Anything from physical therapy. I have excellent physical therapists here that do everything from dry needling to anodyne to deep tissue massage to focused fitness programs. Go back one slide. We have physiatry. We do great neuromuscular testing or nerve testing here to diagnose and treat different problems. We have an aesthetics department headed up by Sarah by Smooth, who's awesome. We do natural wellness. We can tell you what herbs to take for what supplements you need. If you're deficient here, we can help you with either injections or, what supplements to go get. We do IV therapy for people for dehydration and different health conditions. We help people with weight loss, from metabolic workups to lipotropic injections. And we even have a yoga program. In fact, there's yoga going on right now as we speak. And this yoga is focused on people that have issues like, do you have a total knee? Do you have back pain? Do you have a lumbar fusion? So we want people to be able to benefit from yoga, which has about a 10,000-year history of helping people. But we don't want you to be scared, so we kind of guide you and modify it according to whatever your physical limitations are and try to make you more optimized. So that's what we do, and part of this seminar series is going to be financial education for people, because that is a pillar of health that we often forget. For example, the lifetime cost of a major heart attack is like $750,000 for people. So staying healthy is the way to keep your wealth and to keep yourself financially secure. So part of my job or calling, I think, to help people empower themselves to age optimally is I try to help where I can in terms of teaching financial decisions to keep people healthier, because it's all linked. And so today we're going to talk about Medicare. What is Medicare and how to make a good decision when it's time for you to enroll. We're all going to have to do it. It's a law. So you at least need to be educated. And you don't want to be educated by a salesperson on a cold call or a TV commercial. So I'm lucky enough that I met some people from Physicians Mutual who were willing to help me do this seminar, because I'll confess, even though I live Medicare day in and day out and I treat patients with Medicare all the time, I don't really fully understand it. And I'm probably going to have some questions at the end of this seminar myself. So I'm about to turn it over to the team from Physicians take over, and let's all learn what we can about Medicare so that we all have good, happy, healthy lives.
All right, guys. Hello. My name is Skylar Abney, and I have my colleague, Miss Anurada Prabhu with us. We are the team of Physicians Mutual. I have been with Physicians Mutual over 5.5 years now. I am now the assistant manager for the Lafayette, Louisiana office.
It's okay if I get off the screen.
And Miss Anurada has been with us over 6 months now, a little close to 6 months. So she's brand new in the game, but she is a customer or patient of Miss Warner here. So I'll go ahead and let Miss Anurada speak a little bit about herself and how Dr. Warner has benefited her in this situation.
Hi, everybody. Good morning. I'm excited to be here this morning to share with you Medicare 101. Let me tell you a little bit about my history. I'm a baby at Physicians Mutual, but with the help of the awesome management team in Lafayette, this has been a sweet journey so far. And Skylar is one of those awesome people. A few years ago, I had some issues with my foot, and I've been looking for the best care that I can possibly get. And for some reason, I wasn't coming across what I think I needed. Last year, I did come across Dr. Warner on Facebook, and I followed her through some of the information she was sharing, and I found that her direction with treating wellness and taking care of her patients, the way she goes, the direction she's going is exactly the care I needed. So I had my procedure done this year, and that's when I started sharing with her what I do and how I can help better the lives of patients who do carry Medicare. And I'm really excited to be able to offer my help, because I have benefited so much from the clinic and what Dr. Warner is doing, and my therapy sessions with the team over there. They're awesome. So I'm excited here to help and share information and just be of as much service as I can. I'm going to hand you over to Skylar.
Thank you, Anurada. So our job today is to make sure that you guys are educated on Medicare, your different options, making sure you know every single route out there that is an option to you. By the end of today, you guys will all know exactly which route, which option to take, and from there know who exactly to reach out to. Okay, so what both Anurada and I do for a living, we are actually health, life, and retirement planners. However, we specialize in the Medicare market. So any day of our lives, we're meeting with several of seniors a day to reach out and basically educate them like we will be doing today for you guys. Okay, so why don't we just dive right in and jump into exactly what we're going to be talking about today. So by the end of today, you guys will all know what to do when transitioning from an employee to a retiree. You'll know exactly when or if you need to enroll into Medicare. You'll know what all the different parts are consisted of and all the details with that. And then you'll know exactly how you'll actually pay for your health care in your retirement years. When we're working, we're all in our day-to-day lives accumulating assets for our retirement years. And so we want to be smart with our retirement, because guess what? All of us at some point, like Dr. Warner said, has to get onto Medicare. It is a law. And so with that being said, what is Medicare? Okay. Medicare is a federal health insurance program for seniors and other individuals with specific medical conditions. We'll call that Medicare disability. So if you know of someone who is on Medicare that is under the age of 65, know that they are on Medicare disability. if you are someone who are 65 and older, know that you are on Medicare without disability. Okay, you can continue the slide. Now, a lot of individuals also often confuse Medicare with Medicaid. Okay, Medicaid is actually a federal state health insurance program for people with limited resources. Okay, a lot of individuals, like I said, get that confused. And to know that if you do, or to know if you do qualify for Medicaid, the state has limitations, and it's based off of your income that you make monthly, whether you file individually or jointly for tax returns. Okay. When you're speaking with someone who, like myself, is educating you on Medicare, that person should know if you qualify for Medicaid just based off of the questions that they are supposed to be asking you. Okay. So with that being said, Medicare came about in 1965. Okay. It was administered through the Center for Medicare and Medicaid Services. Okay. Now, with that, like I said, Medicare is mainly for seniors, and there are actually 4 different parts to Medicare. Okay. Right around the time of 2003, Medicare had to broaden its horizons, and they came out with something called the Medicare Modernization Act. And that is a separate part to Medicare that a lot of people get confused and think, oh my gosh, this sounds amazing. When ultimately they're not really reading all of the fine print. And so today you'll have a better idea of what that act stands for. Okay. And then in 2010, they broadened it even more to make it even more confusing for you guys. And that came with the Affordable Care Act, a separate part to Medicare that we'll actually learn today. And you'll have a better idea of, do we even have to get on that? Okay. So with that being said, there are 2 very, very important guides that you should keep as a resource for you guys. Okay. And that is one, the Medicare and You book. When you do turn 65, everyone will receive this thick red, white, and blue book in the mail. And when I say thick, I mean hundreds and hundreds and hundreds of pages. And I do not want you to sit there and read through all of that. Today, you should have a better idea of what that thick book means. Definitely save it for your resource, but please don't sit there and read it. I mean, that will take you months and months and months at a time. Okay. And then the last thing that you should receive from any agent that you meet with is a choosing a Medigap policy. I call it the buyer's guide. Now, this educates you on your Medicare supplemental options. Now, like I said, Medicare was created by the federal government. So were Medicare supplements. Okay, so to move on, some questions that you may have throughout this entire presentation that I will cover is, when am I eligible for Medicare? Can I start Medicare when I go into Social Security? What are my options if I retire early? What happens if I keep working past age 65? And if I go on Medicare, what happens to my spouse if he or she is not yet eligible? Okay, so with that being said, today we are going to learn all about your health care needs and what Medicare covers, or Medicare does and does not cover. Okay, so on the next slide, there is an actual pie chart. And as we go throughout this presentation, you're going to start to see bits and pieces slowly start to cover. And then by the end of it, you'll know exactly what Medicare does and does not cover. So why don't we jump into the details of the 4 parts of Medicare? So 4 parts of Medicare, guys. There are Part A, which is consisted of your hospital insurance. Part B, which is consisted of your medical insurance. Together, Parts A and B are consisted of Original Medicare. Original Medicare is what you think of on a day-to-day basis. It is that red, white, and blue card. It is what you, or a lot of you, have paid into most of your life. Okay? And so with that being said, Part C is a Medicare Advantage plan. It is a separate part to Medicare it is not a part of original Medicare. Then there's Part D, which is your prescription drug coverage. So individually, we will learn about each part and what option is actually best for you guys. All right. So Part A. Part A is, like I said, consisted of your hospital benefits. However, I want you guys to think of the Part A benefits or hospital benefits as an overnight stay in the hospital, because all that Part A covers is that room you're in, the bed you're lying in, the TV on the wall, and the food they're feeding you. That's it. Okay? So if you think that you have to go in for a procedure and stay as an inpatient, know that that particular procedure that you're having done is all being part of Medicare Part B. The hotel, the hospital or hotel stay, overnight stay, that is what Part A is covering. Okay? Now, with Part A benefits, you do have a benefit period deductible of 60 days of a total of $1,484. Okay. Now, what I'm specifically talking about right now is if you were only on original Medicare and had nothing else as secondary. Okay. So I'm going to repeat that. What I'm talking about at this point is only if you had original Medicare and nothing as secondary. Okay. So when you have a benefit period deductible of 60 days with Part A, it is $1,484. A lot of us are used to an annual deductible, right? A one-time deductible a year. Well, Part A is different. So I'm going to give you an example, okay? So let's say, knock on wood, we had to go into the hospital as an inpatient to get a knee replacement done, okay? Well, the second we walk into that hospital, they're going to consider that day one, and you are going to be responsible for $1,484. Once you pay that $1,484 deductible, Medicare will pick up 100% for the next 60 days of the Part A benefits, which remember is the overnight stay. Okay, so let's say we had our knee replacement. We stayed as an inpatient for 5 days. We got out the hospital. We went back 2 weeks later because, we developed an infection. Okay, well, 2 weeks later, we're still within that 60-day window, right? So what that means is Medicare's still going to cover their 100%. Okay, but let's say we got out the hospital. Months went by. Oh no, 6 months later, we fall and break our hip. Now we have to have a hip replacement and we have to stay as an inpatient in the hospital. Well, guess what, guys? We're beyond that 60-day window, right? So guess what happens? You have to pay $1,484 again. Okay, you pay that $1,484, Medicare is going to pick up 100% for the next 60 days. So if you time that in a year span, you could actually pay Part A's benefit deductible 5 times a year. Guys, $1,484 times 5? Are you kidding me? So it could happen. I've witnessed my grandparents go through it. My in-laws go through it. It could absolutely happen. Okay. Now, it actually gets a little deeper than that. Okay. So let's say that 6 month later period, we went back for that hip replacement. We had the procedure done, but let's say we never got out the hospital those 60 days. Okay. We paid our $1,484 for the next 60 days. We remained as an inpatient and Medicare picked up 100% for the overnight stay. Well, let's say on day 61, we are still there. Well, what happens here on day 61 through 90, Medicare says, okay, I'm done paying 100%. It's time for that customer to start paying a per day cost to be as an inpatient. And that per day cost on day 61 through 90 is $371 every day, per day you're in the hospital from day 61 through 90. Guys, that's a car note. That is a car note. Okay? On days 90 through 150, if you're still in the hospital, it doubles. Days 150 and beyond, Medicare washes their hands and says, I am done paying. Okay? Now, to backtrack just a little bit, on days 91 through 150, those are called your lifetime reserve days. And everyone has one of these periods in their life. Once you've used them, they're gone. So what that means is, by the praise of God, let's say something miraculously happened. We were good to go after those 150 days. But let's say next year, the exact same thing happened to me again, and we get to days 90. Well, days 90 through 150, they're no longer there. So after that, Medicare covers or washes their hands and says, I'm done paying altogether. Okay? So that is how Medicare Part A benefit period deductible works. It's a little confusing. If you still have questions about how that Part A benefit works, you can definitely comment in the chat feature. But like I said, guys, this is only if you're on original Medicare, so keep that in mind. All right? A little more to do with Part A benefits. You do have skilled nursing care, okay? In order to have skilled nursing care, though, Medicare says you must meet their 3 requirements. And those 3 requirements are you must have a hospital stay of at least 3 days. You must enter a skilled facility generally within the first 30 days after leaving the hospital. And you must need the skilled nursing care at least 7 days a week or skilled therapy day care at least 5 days a week. Once Medicare says check, check, and check, they will cover 100% for the first 20 days of your skilled nursing care. On days 21 through 100, you are responsible for $185.50 per day, every day you're still in the skilled nursing facility on that time span. After days 100, Medicare washes their hands and says, I'm done paying altogether. Okay? This does have that same benefit period, just like the hospital care, except this is the skilled nursing care. Instead of 60 days like the hospital care, it's 20 days here for the skilled nursing care. Okay? Now, some other parts of Part A, you've got blood. Guys, Medicare does not pick up your blood until after you've paid for the first 3 pints. I don't know about you guys, but here in the Lafayette area, the average pint of blood costs anywhere from $1,200 to $1,500, and they make you pay for 3 before they pick up any. Home health care, hospice, those are all fantastic coverages through Part A. Okay, it definitely is great coverage. So now, if we look at that healthcare pie, we've just spoken about the Part A benefits that Medicare covers. Okay, notice here though, the hospital, the home health care, the skilled nursing care, you still have those out of pockets that you're facing, like the $1,484 and all those per day basis from days 60 through 150. From days 20 to 150 with skilled nursing care, you still have a lot of out of pocket that you may face on a day-to-day basis. Now, notice hospice care is fully shaded. It covers 95% of hospice care, and your drugs for hospice are $5. Okay, so that's why I like to say it's really, I mean, it's great coverage there. Okay. Now, moving on to Part B. Okay. When you think Part B, think of everything else. Think of welcome to Medicare visit. Think of preventive services. Think of inpatient and outpatient doctor services, surgical services and supplies, speech and physical therapy, diagnostic tests, durable medical equipment, and ambulance services. Literally think of everything else that we didn't talk about. Okay? So, getting into preventive benefits, guys. Now, this is huge, okay? I don't know about you, but I know as far as Dr. Warner is concerned, preventive benefits can literally save your life. okay? Going in for your annuals, going in for your physicals, those things could save your life. So when it comes to preventive services, Medicare does cover some, and we'll dig a little bit deeper in a second. But the first two that I want to talk about, you're welcome to Medicare Visit. When you get onto Part B of Medicare, which we'll talk about the enrollments and all of that good stuff, but the second you get onto Part B of Medicare, you have a 12-month window to go into your doctor's office and have a review of your health. Notice, it says not a physical. It says a review of your health to receive education and counseling about your preventive services for your future. Okay? The second that you start getting into physicals, Medicare does not cover it, which is crazy to me. We all go in for annuals to get things like that done. I know for me, I don't just sit down and talk to my doctor. He starts drawing up blood. He starts getting a game plan for me, and I'm sure most of you have the same, okay? So just know the key here with your welcome to Medicare visit, it is not a physical. It's just a talk, okay? One time within your first 12 months of Part B coverage. Then there's an annual wellness, a one-time review every single year, okay? Again, not a physical. Strictly a talk. It's a yearly wellness visit to develop or update your preventive plan that you guys have already talked about. Okay, that is key. Now, when it comes to preventive services, Medicare will pay for some, not all. And let's add in the word generally. Okay, they will generally pay for some, not all. Okay. Your doctor may recommend you have certain exams more frequently than others. I'll give a colonoscopy, for example. A colonoscopy, Medicare only covers one every 10 years. Well, the older we get, the doctors normally say, come every 3 to 5 years. And that's facts, okay? So guess what? When you get onto original Medicare, A and B, specifically Part B, Medicare is going to cover your first colonoscopy. Your doctor says, all right, I'm going to schedule you a 5-year follow-up for your next colonoscopy. When you go back, Medicare does not cover it. Okay? Same with mammograms. They only cover one every 12 months. However, if you have a history of that, if your family members have history of that, they more than likely will start to say, come twice a year, every 6 months. Medicare will cover that one. You go 6 months later, they're not covering it. Okay? I will give you a key fact right here. Physicians Mutual is known for saving lives. And I say that because that word generally that Medicare uses in that buyer's guide and in that Medicare and You book about preventive services, Physicians Mutual takes that word generally and says, on any preventive services that Medicare does not cover, we cover 100%, no matter what. A physical, please go and get a physical done once a year because your Physicians Mutual supplement covers it. You have more than one service within the year of the examples I just gave, Medicare doesn't cover it, Physicians Mutual will save your life and cover it. Okay, that is key that you need to know about preventive services because I promise you guys, you will not find that anywhere else. The thing is, a lot of doctors' offices don't even know that. We've had to create a letter stating that because doctors are like, no way, I'm not going to start doing that for you. That's going to cost you $700, $800 in bills, lifeline screenings. To get all that done, that's expensive. And doctors are like, you don't want to do that. You don't want to do that. Your Medicare is not going to cover it. But the second that letter gets handed to them, they're blown away. Okay? So that's something that is very important to know. Okay? So moving on to the Part B details. Okay? To the Part B details. So when it comes to Part B of Medicare, it's way easier to understand. So on the next slide, we're going to talk about that deductible, right? We all know that Medicare Part A has a benefit period of 60 days deductible. Well, Part B is different. Part B is what you're used to. It's an annual deductible of $203. Okay? Notice that 203 and the year of 2021 is in brackets. The reason for that, Medicare does have years where they do increase or decrease their deductibles. And again, that's based off of inflation. So keep that in mind. Once you pay that annual deductible of $203, Medicare comes in and pays 80% of the remainder of the Part B bill. You're responsible for 20%. Now, they do cover 100% of Medicare covered clinical laboratory services, such as blood tests for diagnostic tests. So keep that in mind, blood tests for diagnostic tests, okay? Varying amounts of covered preventive services, which is what we just talked about, and then nothing for any charges in excess of Medicare approved amounts. So what are excess charges? What does that even mean? So if your healthcare provider does not accept Medicare assignment, that provider may charge you more than the Medicare approved amount for your services. And in that case, the difference between what Medicare approves and what a non-participating provider charges, it is called an excess charge. And they can charge you up to 15% of that excess charge. Okay? So keep that in mind. Now, what does Medicare not cover? Medicare Part A and B. So, routine dental, vision, hearing, foot care, long-term care, alternative medicines, cosmetic surgeries, personal care, healthcare outside of the USA, prescription drugs, and non-medical expenses. Okay, so next slide does show, again, another look at this healthcare system with the added Part B expenses. Now, guys, look at this. Take a look at this. We just talked about original Medicare. We talked about Part A expenses, which is shown in red. We talked about Part B expenses, which is shown in blue. Okay? Now, notice all of the gaps in coverage that is still left for you to pay. Okay? That I want you to really take a look at. When people see all of that out-of-pocket cost that they can still face when just on original Medicare, that is why they want to learn more about what is called Medicare supplements. Medicare supplements come in to pick up what Medicare would normally make you pay for plus some. Okay? If you have any questions about Part B, go ahead, or the details of Part B, go ahead and you can put that in the chat. So next up, we're going to talk about if you should even enroll in Medicare, guys. So if you or your spouse are currently working and you receive your health insurance through an employer, you are not required to enroll in Medicare at age 65. And that reason is because you guys have what's called credible coverage. Now, I will say that it is very important to still meet with someone to look at and compare what you are on with your group benefits versus what it would look like with Medicare plus a supplement. And from there, you can check out the best options. Okay, compare and contrast. What is the better option? Because even though you are still working and or on employer coverage, you can still receive Medicare with a supplement and continue to work. It is very, very important to compare your options because in the long run, Medicare could absolutely save you some money. I know it doesn't look like it based off of what we just saw, but with this supplement could save you some money in premium and have way better coverage. So make sure to still compare those options. Now, when you or your spouse do retire, you will have a special enrollment period to go and apply for Medicare without penalty. Okay. Now, do I need coverage for my spouse and family? Well, Medicare will not cover family and a spouse if they are under the age 65. Okay. So keep that in mind because again, it's very important to make sure to compare those options. Okay. Now, how do I even sign up for Medicare benefits? So there are a couple of different ways, guys. If you are new to Medicare and are turning 65, you can apply online at the Social Security's website. You can apply by phone, which is the number listed here, or you can apply in person at your local Social Security office. Now, I will say, I know here in Lafayette, the offices are still not open to the public. They are still taking by appointment only. But this is a list of things that you are going to need to have in order to enroll, because it's got to identify you, and to identify you, it asks you a whole bunch of personal questions. So make sure to just keep all of that in mind. If you would like to screenshot or take a picture of this page, I would do so now. Okay. So signing up for Part A. So you are automatically enrolled for Part A benefits when you're receiving Social Security and you turn 65. So if you are 64 and a half and you're already drawing on Social Security, there is no need to personally go and apply for Medicare Part A, because they see that you're drawing on Social Security. They automatically send you that red, white, and blue card. So remember, there is no need to go and apply if already drawing. Now, most Medicare beneficiaries pay no premiums. If you've worked at least 10 years out of your life, or 40 quarters is what they call it, which is 10 years, there is no cost to Part A. It's free. It's what you paid into all of your life. Now, if that's not the case, if you are single, never been married, never worked, then that cost to Part A is around about $450 a month. Okay? But if you're married, never worked, husband's worked all his life, you can draw off of your husband and have Medicare be free. Okay, so that's the key. Now, when you in your specific situation, save your situation. If there's questions about your specific situation on the back end, you and I can talk. But those are really the most two common that I see. So just know, altogether, if you're drawing on Social Security, you will automatically be enrolled, and it is no cost to you. If you're not drawing on Social Security, you will have to physically apply yourself. So take it in your head right now, know your situation and write your situation down as far as if you're going to have to apply yourself or if you're automatically going to be enrolled. Next up, when and how, okay? So everyone when turning 65, you have different enrollment periods, okay? There are 3 specific enrollment periods. Let's talk about that initial enrollment period first. Initial enrollment period, every single one of you has an initial enrollment period when you are turning 65. It is a 7-month window. That window is consisted of 3 months before your birthday, the month of your birthday, and 3 months after. So you have a 7-month window, sorry. You have a 7-month window to go and apply for Medicare without penalty. Okay? Now again, keep in mind, if you're currently still working and have employer coverage, you will not get penalized because you have credible coverage. After finding out if Medicare was the better option, then go ahead and apply for Part A. If your employer coverage is the better option, still apply for Part A. It's free. Okay, you won't ever have to worry about it. Just apply for it. It's free. It's secondary. Your group coverage will be primary. Okay, so again, that initial enrollment period, a 7-month window. Now, Medicare always takes effect the first of your birthday month. My birthday is November 19th. My Medicare becomes effective November 1st. It's the 3-month window from the first of that month, okay? So keep that in mind. Then there's a general enrollment period, okay? General enrollment period, let's say you missed, back one slide. The general enrollment period, let's say you missed that 7-month window, okay? And you were not working. You had no credible coverage. In this scenario, that falls under you having to enroll in a general enrollment period, and that takes place January 1st through March 31st for your Medicare Part A to be effective that following July 1st. And don't forget, in this scenario, you get a 10% penalty. Okay? So I'm going to repeat that. The general enrollment is when someone misses their initial enrollment period and never had credible coverage. In that case, the general enrollment period starts the following January 1st to March 31st with an effective date of July 1st with a 10% penalty. Okay? Next enrollment period is the special enrollment period. Okay? There's a couple of different scenarios here. The most common is when someone continues to work and stays on their employer coverage. In this situation, I always say, go ahead, still apply for Part A. It's free. When you know that it is time to retire, and you know when your last date of employer coverage is going to be, you have from that last day 63 days to go and apply for Medicare Part B. 63 days. Why did they not just say 60? I don't know. But 63 days. Okay. So when you know in your head, okay, I'm going to apply my last date of, I'm going to retire. My last date of coverage is going to be August 30th. In your head, you should be contacting your either agent that went out and educated you, or if you plan to do it on your own, fantastic. I always help my clients with this because there's certain forms that you do have to fill out in order to get everything set up. Okay. So again, certain scenarios for special enrollment periods, but the most common is if you continue to work. Okay. When that happens on the last date of from the last date of coverage, you have 63 days to go and apply for Medicare Part B. Okay. Next up, signing up for Part B. Here, if you get Social Security benefits, you will automatically get Part B. Okay, they will automatically send that your way. Okay, if you decide you do not want Part B, for example, if your employer coverage is the better option, if you don't want Part B, you just follow the instructions that come with the card, and that's going to consider you deferring Part B. Okay, so if you do not want Part B, it's called deferring Part B. Okay, if you automatically get that card in the mail, like I said, follow those instructions, send the card back, you'll defer Part B. If you're not drawing on Social Security, but yet you've wanted to apply for Part A only, there is an option on the website to say apply for Part A only. Okay, that in that case, is deferring Part B, just in a different situation. Okay, next up, signing up for Part B. Again, if you didn't sign up for Part B within your first initial enrollment period, that 7-month window, you have those 2 periods to do so. General enrollment, if you basically didn't have credible coverage and you missed it, remember that's that 10% penalty. And then that special enrollment period, okay? Now, if you're age 65 or older, after you sign up for Part B, you have a 6-month Medigap open enrollment period, which gives you a guaranteed issued right to buy a Medicare supplement insurance policy. Okay, this is huge, guys. Okay, I will tell you why. When someone is ready to apply for Part B, you need to be thinking, I've got to get a Medicare supplement, because pre-existing conditions, throw that out the window. It does not matter. You automatically get enrolled no matter what. After that 6-month window, though, guys, you have to answer health questions. And from that point on, you may not qualify for a Medicare supplement, which then leaves you only having original Medicare alone, leaving you with all of those gaps in coverage from that healthcare pie we looked at. Okay, so keep that in mind. On the next slide shows a chart. Remember, Part A is free, right? Well, Part B is a little different, guys. Part B, there is a monthly premium to pay to have it. It is based off of if you file individually or jointly. Now, this is also based on your 2 years prior tax return. So if you turn 65 January of next year, they're going to look at your tax returns from 2020. Okay, they're going to say, okay, Mr. Sam filed jointly. He made $176,000 or less, so his monthly premium is going to be $148.50. Okay, every month for this, from the second you start your Part B, this will be drawn. If you're drawing on Social Security, it comes out of your Social Security check every single month. If you're not drawing on Social Security yet and you're planning to wait until your full retirement age, then it will be coming out of your checking account. Okay, so keep that in mind. Any questions with that? Go ahead and put them in the chat, guys. What we just talked about was original Medicare, your first option to Medicare. Now, I have to take a sip of my coffee. Now, let's go ahead and talk about Part C, Medicare Advantage. When you choose sign me up for a Medicare Advantage plan, you are being removed from original Medicare. I'm going to say that again. When you raise your hand and say, sign me up for a Medicare Advantage plan, you are being removed from original Medicare. This private health plan replaces original Medicare. You do not have both. You have either or. Okay? When you do that, there are a ton of different things that happen. One, you're restricted. You can only go to their list of hospitals and doctors. The average in-network, average out-of-pocket on one of these plans is $7,550. I'm going to repeat that. The average in-network out-of-pocket cost that one can face is $7,550. Out-of-network, over 10 grand. If you are someone who wants the best healthcare out there, knock on wood, something happens and you get diagnosed with cancer and you try to go to MD Anderson, no ma'am, they don't accept it. And guess what? You're out of network. It's optionally renewable every year. When you start to see all these commercials come October 15th through December 7th, they're going to promote it like crazy, guys. You can get dental, vision, hearing, a gym membership, your groceries to be delivered to you. You could get all these things that happen in this particular plan. However, every year they have the right to say, I'm no longer going to service in this area. I'm dropping people off of this plan. Or the doctors can say, I'm no longer accepting so-and-so company or so-and-so Medicare Advantage plan, which there are a list of them out there. Okay. It is a private health plan. Okay. Doctors can choose if they want to. They can choose if they do or don't want to. I'm sorry. And then that actual private health insurance company can choose if they do or do not want to service that network anymore. Okay. Now, within these out-of-pocket costs, within that maximum out-of-pocket, that $7,550, they do have their own deductibles, co-pays, co-insurance, depending on the plan. If you go onto Medicare.gov, write this down, Medicare.gov, and you go to try to see what kind of Medicare Advantage plans are in your network, please make sure to read the fine print, okay? Because they try to get individuals by saying you can have everything bundled when a lot of things, one, are not covered. Two, you have to have plan prior approval to even get something done. Okay, which when you're on original Medicare, they see that it's provided by the federal government. Original Medicare, no worries, it's done. Supplement coincides with original Medicare. So if original Medicare covers it, no matter what, the supplement will. It's again a federal government program. Here, it's different. The insurance company dictates your health care. They say, well, hold on a second. I have to see, the doctor says, hold on a second. I have to see if this company will even be able to pick up the cost of this before I can actually get it done. And they may come back and say, well, in order to get that done, you need to do this, this, and this. And this, and this may not even be required by your doctor. So just keep that in mind, okay? Read the fine print. I can't say it or stress it any more than that. To read the fine print, make sure to go on Medicare.gov and find the Advantage plans in your area because it'll list them, okay? Now, with the max out-of-pocket of $75.50, read that. You cannot purchase a Medicare supplement insurance to cover those deductibles, those copays, and those co-insurance that coincide with this private health plan. So I like to say, come your birthday month, Original Medicare will be your primary insurance. Your Medicare supplement will be your secondary insurance. If you choose the other option of a Medicare Advantage plan to be removed from Original Medicare, that private health plan is your primary insurance. Guess who's secondary? Guess who's having to pay all those deductibles, copays, and co-insurance? You, because you cannot have a Medicare supplement to be secondary. So you are secondary. So keep that in mind, okay? When it comes to Medicare, you have 3 options, okay? And we'll get to those to sum it up in a second, but just keep that in mind. You have 3 options. The last part of Medicare is Medicare Part D, which is a prescription drug plan. When someone turns 65 or when someone gets on Part B of Medicare, you have to have a Part D. It helps lower your prescription drug costs. If you do not get a Part D, you will be penalized. Same with Part B, as in boy. With Part D, if you do not get on it, you will be penalized. Now, again, this just helps lower your drug costs. It is based off of your medications in the pharmacy of choice, okay? So there's about, in my area, 26 different Part D as in dog plans out there. And for example, my mom may not have the same Part D as my dad because my mom is on total different medications than my dad, okay? So again, it's based off your prescriptions and based off of the pharmacy of choice. So with that being said, I always help someone find the absolute best plan out there because these do change every single year. Whereas Original Medicare and your Medicare supplement, you're married to that for life. That will never change. That coverage will never change. But when it comes to Part D plans, even Part C plans, those things can change. And so every year from October 15th through December 7th, I reach out to every single one of my clients, which there's a lot of them. And I want to make sure that plan is still the best option for them going into the very following year. Because again, these plans change, better ones come out. And so it may be a better option for them to choose that better option. So keep that in mind, guys. So to sum this all up, Medicare alone may not be enough. Okay, so you ultimately have 3 different options. On the next slide, you have options to help pay for your medical expenses. Your first one is Original Medicare alone. Keep in mind that red, white, and blue pie chart that we looked at. Keep in mind of all the things that were not covered. Okay, that's Original Medicare alone. Or your option number 2 is Original Medicare with a Medicare supplement. Remember, a Medicare supplement picks up what Medicare normally would make you pay for. Okay? So you are limiting yourself to all of that out-of-pocket exposure. Then there's option number 3. Privatized Medicare, Part C, Medicare Advantage. Networks, maximum out-of-pocket on average is $75.50. Plan prior approval, their own deductibles, copays, and coinsurance to coincide with Medicare, and you do not have a supplement to pick those things up. You are secondary. So those are your 3 different options when it comes to choosing your healthcare coverage in your retirement years. Your prescription drug plan, no matter the 3 options, you have to have a Part D to coincide with whatever you choose. Okay? Again, everyone's needs are so different, and that's why it's very important to sit down and get educated, like today, but really dive deeper on your situation. Okay? If you are still confused today, you need to meet with someone. Okay? And if you are not confused but know your route, it's time to get educated on that second part. Okay, like these supplemental coverages. Okay, so what do you do now? Okay, what do you do now? Everyone, like I said, has different needs, have different situations. I am, and so is Anurada. We are licensed agents in the state of Louisiana. Okay, we help educate first. We want to make sure that you guys know your options. Okay, you've all paid into Medicare, most of you, all of your life. You should have the freedom of choice of your own health care. You shouldn't have someone else dictate what you can and can't do. So if you do have any questions, you could please contact Ms. Anurada or myself. Our names and numbers are located in the chat feature, or should be, okay? But if you do have questions, we do not mind sitting down with you guys, going over the phone, virtually setting up a meeting. We do it all. It's what we do for a living. We want to make sure, 1, we save your life. 2, that we financially give you the peace of mind knowing that your healthcare coverage in your future retirement years is the best option for you. Okay? That's all that I have for you guys. If you have any questions, or Natalie or Dr. Warner, if you guys want to jump on, I don't know what you guys want me to do at this point. Let's see in the chat feature.
Can I ask a question?
Yeah, please.
All right. It's hard for me to hear you, Skylar, the way my tech package is set up here, but I have a couple questions based on things I've seen happen to my patients. I actually had a patient recently who told me that she opted out of Part D Delta, so none of her drugs were covered. And so she's paying cash for all her drugs. I was trying to prescribe her, I don't know, some prescription supplement that I wanted to give her. Is there a way to get into Part D later?
Yes, ma'am. So that enrollment period to get into a Part D plan is October 15th through December 7th. And every month that she's waited from getting onto Part B, as in boy, she's going to face a 1% penalty each month. For, let's say she waited 2 years, that's a 24% on the premium that she's going to pay every month for her Part D plan. But that time frame, like I said, is October 15th through December 7th. Can you hear me? Uh-oh, I can't hear you.
I can't hear you either, Dr. Warner.
Are you there? Uh-oh, okay, so I'll kind of, until she comes back. Like I said, every month that you wait, you guys do face a 1% penalty each month up until that you do get that Part D plan. I've had someone who was 71 years old, never had a Part D plan, so he's facing about a $70 penalty every single month now on top of his premium. So very, very, very important to know to get a Part D plan, even if you're on 0 medications, because the cheapest plan out there is $7 a month, for example. So yeah,
she's back, Skylar.
You're good. Okay.
Okay, you can hear me now, Skylar?
Yes, ma'am.
My next question is, you spoke about a maximum out-of-pocket for the Advantage plans. Was that annual or lifetime out-of-pocket?
That is that is not a lifetime out-of-pocket. That's an annual maximum. And every single plan is different. The average used to be $6,700. Like last year was $6,700 a year. It went up to $7,550 a year. And so again, Dr. Warner, a good thing for you to know, especially you dealing with a lot of individuals who have these plans, go onto Medicare.gov, put in your zip code, do a standalone Advantage plan, and do not compare. And all of those plans pop up, and you'll be able to see exactly what that plan is all about. But that is an annual maximum, not a lifetime maximum.
Oh, wow. Okay. That makes sense, because a lot of my patients that come in with, say, Humana Gold or People's Health or WellCare, those Advantage plans, they seem to always have to pay a $35 to $50 copay every time they see me. They end up paying 20% of the cost of, like, let's say a knee brace, which those are expensive braces. They have to come out of pocket for 20%. Diabetic patients have a lot of costs that they incur with different braces and surgeries. And I've also found that those Advantage plans don't cover any advanced wound care products, any advanced modalities, nothing cutting edge. It's actually kind of sad, because my Medicare people that have a supplement, they really do get a lot better, a lot more choices, and a lot more advanced techniques available to them. But I don't know what the deal is with the Advantage plans, but they seem to convince a lot of people to go that route, and I just find it's very restrictive.
Right.
But that out-of-pocket cost was surprising to even me, and I see them spend this money.
Yeah.
I had another question. Let's say you have an HSA, a health savings account, and you have some reserve money in it when you're 65. You can use that towards your premiums, correct?
So you cannot use the HSA for premiums. You can use it for any kind of deductible, co-insurance, or co-pays.
Okay. Okay. And then
somebody asked, will the presentation be available? And the answer is
yeah. Somebody just asked online if this presentation will be available. So all of you out there, this will definitely be available for you to watch again. I know it's very complex and confusing, and of course you can always call Skylar or Anurada with questions. They know way more about this than I do.
Yeah, I love it on your end, Dr. Warner, because you see firsthand. You know, you see your patients, what they have. So I love that you were, like I said, you were seeing it, and so that is why you brought us, because you feel sorry for the ones who have those Advantage plans versus the ones who are on original Medicare. So thank you for having us.
Okay, good. I wanted to clarify one thing. So you said you have a certain window when you get into Part B, where if you buy the supplement, there's no pre-existing condition, nothing matters, you're in. But if you wait, then you may not even have a chance to get a supplement. I did not know that.
Yes, ma'am. Yeah, so when someone gets onto Part B, you always have a 6-month window to go and apply for a supplement without health questions. And then again, if you do miss that window, underwriting is involved, and every company is different. So it's very important to know when you're eligible for Medicare, be looking for that supplement with it.
Okay. And then I had one other question. Let's say you picked Humana Gold, and then you found that you had a lot more healthcare costs than you thought you were going to have, and you wanted to go to a Medicare with a supplement. Can you ever switch back?
Yes, ma'am. So same time frame, October 15th through December 7th. You have the option to switch back from Medicare Advantage to original Medicare. But in that situation, you have to answer health questions.
Right. So it's very important to make the right decision early.
Up front. Yes, ma'am.
Right. Because I find the people that have the worst health, that have these Advantage plans, end up spending the most money. And had they picked the alternative, Medicare with a supplement, they would be way better off financially. But they're kind of stuck, and it makes me very sad.
Yeah.
I think that's all the questions I had. Again, this will be available online, everybody, on my website under the webinar tab.
What's your website?
warnerorthopedics.com, www.warnerorthopedics.com. So you can watch this over and over and over again. All right, thank you everybody for attending again. Skylar Abney and Anurada Garibasant with Physicians Mutual, and I'm so thankful they did this. I learned a lot, and I hope you guys learned a lot. And again, it's very complicated. I wouldn't make these decisions alone. Probably talk to somebody about it that is knowledgeable.
Absolutely. Thank you guys for having us, and please feel free to reach out to us. We are willing to help you guys. We do. Anurada's in the Baton Rouge area. I'm in the Lafayette office, but we travel all across the state, so we're willing to help.
Thank you, guys. It's been an awesome pleasure trying to see how we can help the community. That's what we're about. We're about service.
Right. All right. Well, everybody enjoy your weekend.
You too.
You guys too. Have a great one. Bye-bye.
Take care, guys.